helping make your life easier. Moms every day.
We've heard about the importance of getting the influenza vaccine, but if you have an egg allergy, are you safe to get the vaccine? Dr. Petra Razdan is an allergist with Allergy, Asthma and Immunology Associates. Good to have you here today, doctor.
Nice to be here.
So, does the vaccine, the influenza vaccine, contain egg?
Actually, most influenza vaccines do contain a very small amount of egg because they're grown in fluid from chick embryos, but the level is less than 1 microgram per dose and is not considered dangerous for egg allergic patients.
So it has to have egg in it of some sort?
Very small amount.
But it's very small, all right. So let's say you are allergic to eggs. Should you get the flu vaccine?
Absolutely. Latest guidelines from all sources say that it's safe, and you don't even have to ask the patients or the child if they have an egg allergy. It is very safe and has not been associated with any severe allergic reactions like anaphylaxis.
What kind of reaction would you get?
So I would say if you can be allergic to the flu vaccine, but those studies have shown are not related to the egg content, that can be related to the vaccine itself and stabilizers. So no matter what your egg allergic status, I would highly recommend you to get the flu vaccine every season.
Okay, I know there are certain people who should definitely get the flu shot every year. Those who are older, those who are pregnant, and those who have maybe a chronic respiratory disorder, right?
Absolutely, specifically less than 2 years old, older than 65, and if they have asthma, and very commonly do those people also have an egg allergy because it's one of the allergic diseases that we deal with.
Okay, so I'm sure a lot of people have questions about this. What should they do? Who should they turn to?
I think talk to your pediatrician. The American Academy of Pediatrics guidelines also say that you should vaccinate even though whatever your egg allergic status is. Call our office if you have questions too. We would be very happy to guide you along that. There's no skin testing that's needed with the flu vaccine prior to getting it. So,
I know, doctor, if you don't get the flu vaccine, there are a lot of complications that can arise from the flu.
Absolutely. The influenza is a very dangerous virus. It can cause, a very dangerous pneumonia after you've contracted the virus. In asthmatic patients, they usually end up on prednisone, sometimes an antibiotic because they develop pneumonia and dehydration, etc. So flu vaccine should be given every single year. It's a seasonal vaccine. It changes every single year, but it really prevents a lot of hospitalizations, ER visits, and deaths from this flu vaccine, from the influenza virus.
What's the latest you could get the shot?
I would say get it at any point in time. People say, oh, I missed the boat, it's December, I don't want to get the flu vaccine. But this year we saw in our clinic, we saw flu virus all the way till end of April. So I would say even if it's December and you've had a busy fall, get the flu vaccine. I think you're going to really get through that season that's tough, January, February, March.
Perfect. Doctor, thank you. For more information on Allergy, Asthma and Immunology Associates, visit momseveryday.com.